Joint pain in seniors across the United States, Canada, United Kingdom, and Australia has become one of the leading reasons why so many people lose their independence, their mobility, and, honestly, their joy in life. It's heartbreaking when you hear real stories, like a man in Florida who used to walk 3 miles a day and now can barely stand up without feeling a sharp stabbing pain in his knees. Or a woman from Ontario, Canada, who loved gardening for decades, but her wrists are now so stiff that she can't even lift a watering can. For seniors, the right vitamins for joint health are not just helpful. They can be life-changing. They can be the difference between getting back to activities they love or sitting in pain, watching life pass by. The first critical vitamin that seniors absolutely need for joint health is vitamin D3, especially in the United States, where studies show nearly 40% of older adults are deficient. Vitamin D3 is essential because it supports calcium absorption, which directly impacts bone density and joint strength. Without enough vitamin D3, bones become brittle, joints weaken, and pain becomes a daily nightmare. Seniors in the United Kingdom and Canada, where there is less sun exposure, are at even higher risk of D3 deficiency, especially during long winters. A 2020 report from a major healthcare center in Australia revealed that seniors taking at least 2,000 IU of vitamin D3 daily had significantly less joint discomfort compared to those who didn't supplement. Think about this. A simple soft gel each morning could prevent years of suffering and expensive treatments. Another key player for seniors is vitamin K2, often overshadowed but absolutely critical when paired with vitamin D3. Vitamin K2 directs calcium to the bones and joints where it's needed and away from the arteries, preventing dangerous calcifications. American healthcare providers have started recommending K2 alongside D3 for patients with osteoporosis and arthritis. In cities like Dallas, Texas, many seniors reported in patient surveys that after beginning a daily K2 supplement, their joint stiffness in the morning reduced by almost 50% within 2 months. Imagine being able to get out of bed without feeling like every joint is cemented in place. It's not magic. It's smart supplementation rooted in real biochemistry. Vitamin C is another absolute powerhouse. Not enough people realize how important vitamin C is for the production of collagen, which is the very framework of cartilage, ligaments, and tendons. Seniors in the United States frequently develop scurvy-like symptoms, not because of complete deficiency, but because their levels are too low to support connective tissue health. A powerful double-blind study in the United Kingdom found that seniors taking 500 milliliters of vitamin C twice daily had visibly thicker cartilage in knee joints under MRI scans after 1 year compared to those who didn't supplement. Without collagen, joints grind together, inflame, and deteriorate rapidly. It's heartbreaking to think that many people could save their joints simply by popping a small, inexpensive vitamin C tablet daily. Vitamin E deserves a spotlight too. The anti-inflammatory benefits of vitamin E, especially the tocotrienols, form which many Americans don't even know about, are crucial for joint longevity. Chronic inflammation is the silent destroyer of joints, wearing down cartilage year after year. Seniors in Australia have started using vitamin E-rich diets and supplements as part of arthritis management programs, with noticeable improvements. One senior center in Sydney documented that after 6 months of high-potency vitamin E supplementation, participants had on average 30% more range of motion in arthritic joints and reported a massive reduction in daily pain scores. Imagine what that could mean for someone who has spent years relying on dangerous prescription anti-inflammatories with terrifying side effects like gastrointestinal bleeding or kidney damage. We cannot ignore B vitamins, especially B6 and B12, which play pivotal roles in reducing homocysteine levels. Elevated homocysteine is a serious but often overlooked cause of joint degradation and inflammation in seniors. Blood tests across geriatric clinics in the United States show a consistent trend. Seniors with the worst arthritis often have dangerously high homocysteine levels. Proper supplementation with B6 and B12, particularly in bioavailable forms like methylcobalamin for B12, can lower homocysteine, cool systemic inflammation, and help preserve joint function. In a revealing 2019 clinical trial done in the United Kingdom, elderly participants who took a B complex with high levels of B6 and B12 reported greater hand grip strength and less joint stiffness after just 3 months. Think about that. Stronger hands to hold onto a walker, to open a jar, to pick up a grandchild. These are small miracles that vitamins can actually deliver when used correctly. Omega-3 fatty acids, while technically not a vitamin, need to be emphasized because the United States healthcare guidelines strongly recommend them for inflammatory joint diseases like rheumatoid arthritis. Seniors in Canada and Australia routinely supplement with high-purity fish oil, and this practice has been tied to a significant reduction in joint swelling and morning stiffness. Doctors in clinics from Seattle to Miami have shared case studies where patients reduced their dependency on prescription anti-inflammatory drugs after 6 months of omega-3 supplementation. Why are omega-3s so powerful? Because they create anti-inflammatory molecules called resolvins and protectins that actively reverse the chronic joint damage that standard diets full of omega-6 fats from processed foods cause. If you live in the United States and eat a standard American diet, you are massively out of balance and driving your joints toward degeneration unless you supplement properly. Magnesium is another silent hero for joints. Without enough magnesium, muscles become tense, leading to joint misalignment, extra strain, and chronic pain. Surveys from healthcare institutions across the United States show that 60% of seniors are magnesium deficient. The lack of magnesium also affects vitamin D metabolism, meaning even if you supplement with vitamin D, it might not work unless your magnesium levels are adequate. Seniors in the United Kingdom have been increasingly encouraged to use magnesium glycinate supplements because of their superior absorption rates and gentle effect on digestion. Case reports from Canada have demonstrated that seniors taking magnesium glycinate at night not only slept better, but woke up with far less joint pain and cramping. The reality that many seniors face is brutal. When they complain to healthcare providers in the United States about their joint pain, they often leave with prescriptions for strong painkillers or corticosteroid injections. These options come with frightening side effects: liver damage, osteoporosis, stomach ulcers. Yet very few doctors spend enough time educating their senior patients about the nutrient deficiencies underlying their pain. This failure leaves thousands of seniors every year suffering unnecessarily, trapped in a vicious cycle of medications without addressing the root causes. Real people, real pain, real lives hanging in the balance because of a system that too often chooses symptoms, suppression over true healing. Seniors in Australia and Canada are now starting to shift toward integrative healthcare models that emphasize supplementation, physical therapy, and anti-inflammatory diets. In the United States, this movement is slower, but growing. More and more seniors are asking their doctors about natural options. They're demanding blood tests for vitamin D levels, asking for homocysteine checks, choosing high-quality vitamins from reputable brands, and fighting for their right to live without constant, debilitating joint pain. This shift is emotional and deeply personal, because joint health is not just about moving without pain. It's about reclaiming freedom, independence, and dignity. One of the saddest stories I ever heard came from a Vietnam veteran living in Michigan who said he could survive the battlefield but couldn't survive the constant joint pain that stole his life inch by inch. He finally found relief not through the VA hospital system, but by working with a holistic practitioner who put him on a customized vitamin protocol, including vitamin D3, K2, magnesium, B-complex, and high-dose omega-3s. Within a year, he went from being wheelchair-bound to walking 3 blocks unaided. His story should not be the exception. It should be the rule for seniors across the United States, United Kingdom, Canada, and Australia. Vitamins are not magic bullets, but when chosen correctly and taken consistently, they can be powerful tools. They can rebuild, strengthen, and protect joints from further damage. Seniors must be very critical when choosing supplements because the United States supplement market is massive and not all products are trustworthy. Always look for third-party tested supplements, ideally from brands that follow good manufacturing practices, GMP. Avoid cheap synthetic vitamins that are poorly absorbed and can sometimes do more harm than good. Many seniors have reported on American health forums that after switching from bargain bin brands to pharmaceutical-grade supplements, they saw results in joint health within weeks rather than years. Zinc is another mineral that plays a huge, underappreciated role in joint health for seniors. Zinc is crucial for tissue repair, collagen formation, and reducing inflammation that attacks the joints over time. Seniors in the United States frequently show low zinc levels in blood work, especially those living in assisted care facilities where diet quality is often very poor. In one fascinating report from Canada, seniors supplementing with 25-30 milliliters of zinc daily showed a noticeable improvement in joint mobility and pain reduction within just 3 months. Think about the magnitude of that. How such a small trace element could mean the difference between someone being able to grip a fork or being fed by a caregiver. Zinc, in combination with vitamins C and D3, acts synergistically to rebuild and preserve critical joint structures that allow for freedom and dignity. Selenium should never be overlooked either. Selenium is a powerful antioxidant that protects the joints from oxidative stress, one of the major hidden causes of cartilage erosion. Seniors in Australia have been included in recent studies showing that selenium supplementation can significantly reduce biomarkers of inflammation linked to osteoarthritis. In one Australian study, seniors taking 200 mcg of selenium daily had lower CRP levels, a major inflammation marker, by almost 20% compared to placebo groups. United States-based integrative doctors are now also suggesting selenium for seniors, especially when there's evidence of autoimmunity that may be eating away at the joints from the inside out. Selenium's role is emotional because it is about preserving what is left, protecting what remains strong, and fighting back against a slow, invisible degeneration that steals joy every single day. Turmeric extract, specifically standardized to 95% curcuminoids, though not a vitamin, is something many healthcare providers in the United States recommend for seniors looking to support joint health naturally. Seniors from states like Arizona, Florida, and California, where natural medicine is more popular, are reporting major success stories combining turmeric supplements with traditional vitamins. Curcumin, the active compound, is a strong anti-inflammatory and antioxidant that can dramatically decrease the pain and swelling associated with osteoarthritis. Researchers from the United Kingdom showed that high-quality turmeric extracts could perform nearly as well as ibuprofen in reducing knee arthritis symptoms, but without the terrifying side effects. Seniors using turmeric daily often describe it as getting their life back without losing their stomach lining, a painful but real risk with NSAIDs like ibuprofen and naproxen, so common in the United States healthcare system. Collagen supplements deserve major attention, especially for seniors across Canada and the United Kingdom who are battling advanced joint degeneration. Type 2 collagen specifically has shown impressive results in clinical trials, promoting cartilage regrowth and reducing autoimmune attacks against joint tissue. In one double-blind study done in the United States, seniors with moderate osteoarthritis who took just 40 mg of undenatured type 2 collagen daily experienced significantly less joint swelling and greater walking endurance after only 3 months. Collagen helps not just the joints, but also improves skin elasticity, bone strength, and overall resilience. All crucial things seniors are desperately fighting to maintain. When a senior tells their story about being able to walk their granddaughter down the aisle because they could move without severe joint pain, that's not just physical recovery. It's emotional healing on a profound level. MSM, methylsulfonylmethane, is another nutrient now widely used across the United States healthcare landscape for joint health. MSM provides sulfur, critical for building healthy collagen and cartilage, and it fights inflammation at the same time. Seniors from support groups in places like Houston, New York City, and Chicago have shared emotional testimonials about finally finding relief from brutal, stabbing joint pains after starting MSM supplementation. Some mentioned that even their sleep improved because the pain no longer kept them awake at night. Clinical studies from Australia show that MSM combined with glucosamine sulfate can reduce joint pain scores by nearly 30% in seniors within 12 weeks. That's the difference between needing a wheelchair and enjoying a walk in the park. Another vital supplement for joint health that is becoming more popular in the United States and Canada is Boswellia serrata, often referred to as Indian frankincense. Boswellia has potent anti-inflammatory effects that are distinct from pharmaceutical drugs, targeting specific inflammatory pathways without harsh side effects. Seniors using Boswellia have often reported less stiffness and better range of motion within weeks. In a landmark clinical trial in the United States, seniors with arthritis who took Boswellia extract daily saw an improvement in joint function by more than 40%, while also lowering their use of over-the-counter painkillers. Imagine being able to enjoy a morning walk without limping, simply because nature provided what was missing. It's critical to emphasize to seniors that none of these vitamins or supplements work in isolation. Synergy is the key. Healthcare practitioners from major hospitals in the United States, like Mayo Clinic, have been pushing the concept that a full anti-inflammatory program, diet, vitamins, physical therapy, is necessary to see real transformation. Seniors must ensure they are combining their vitamin D3 with K2, taking magnesium with vitamin D, using omega-3s alongside anti-inflammatory herbs like turmeric or boswellia. Those who have succeeded, those who have beaten back the grip of arthritis and joint degeneration, are the ones who built their programs smartly, thoughtfully, and patiently. There's also a growing awareness that seniors need to focus not just on what they add to their bodies, but also on what they remove. In the United States, where processed foods are heavily marketed to older adults, it's tragic to see how much hidden sugar, trans fats, and preservatives sneak into senior diets. These inflammatory foods silently accelerate joint degeneration. In Canada and Australia, some senior centers have started educational programs teaching residents to avoid these foods while emphasizing clean, nutrient-dense eating paired with smart supplementation. Reports from these programs show seniors needing fewer medications, enjoying better mobility, and even scoring higher on cognitive tests. Because inflammation affects the entire body, not just the joints. Seniors must be careful with dosing and form when selecting their supplements. For example, choosing vitamin D3 over D2, selecting methylated B vitamins rather than synthetic forms like cyanocobalamin, and opting for magnesium glycinate instead of magnesium oxide can make an enormous difference in results. Poor forms of Vitamins are rampant across supplement aisles in the United States, and unfortunately, many seniors are unknowingly buying products that will not be absorbed properly, leading to frustration and wasted time. Knowledge is critical. Knowing what to look for, asking questions, demanding high-quality products. This is how seniors can protect their joints and reclaim their lives. Many seniors across the United Kingdom are also discovering the value of personalized supplementation. Some clinics now offer nutrient testing that allows a doctor or nutritionist to customize a vitamin protocol based on individual deficiencies and genetic needs. This method is still emerging in the United States, but holds incredible promise. Imagine knowing exactly which vitamins you lack and tailoring your supplement plan perfectly to fix the gaps, instead of guessing and hoping. Real-life testimonials from American seniors who have done nutrient testing often talk about dramatic improvements not just in joint health, but in mood, energy, and overall vitality. One heartbreaking reality is that many seniors, especially in rural parts of the United States and Canada, do not have easy access to high-quality health care or supplements. They rely on big-box stores or low-quality pharmacy brands, leading to inconsistent results and mounting frustration. There are countless stories of seniors giving up on supplements altogether, thinking they don't work, when in reality, they simply never had the right products in the first place. Seniors deserve better. They deserve the best science has to offer, not second-rate solutions that pad corporate profits while delivering little real healing. It's also worth mentioning that mental health directly impacts joint health. Seniors suffering from depression and loneliness, common issues across nursing homes in the United States and the United Kingdom, have higher levels of inflammatory markers that worsen arthritis and joint degeneration. Fighting for better mental health support through social interaction, therapy, exercise, and yes, targeted nutritional supplementation is essential. Emotional health and physical health are inseparably linked, and ignoring one inevitably sabotages the other. Vitamin supplementation for joint health is not a luxury. It is a necessity, a weapon in the fight for independence, dignity, and quality of life for seniors across the United States, United Kingdom, Canada, and Australia. Every bottle of vitamin D3, every capsule of turmeric, every soft gel of fish oil is not just a pill. It's a statement of hope, of courage, of determination not to surrender to the slow erosion of time and inflammation. Seniors are fighters, and with the right information and tools, they can stand stronger, move freer, and live better than ever before.